Good afternoon, folks. Now we're discussing for A, preventative and self-care. Okay? The difference between the two. All right, so here we go with today's presentation A. Preventative care is what you do to stay well. Seek medical attention when symptoms are new, severe, worsening, or don't improve after a reasonable period. If in doubt, contact clinician. Early evaluation prevents complications. Symptoms new, severe, rapidly worsening, or unexplained bleeding or shortness of breath. Seek medical care now. Minor problems that improve in 48 to 72 hours with self-care can often stay at home. Persistent or reoccurrent issues need evaluation. Risks profile: old age, pregnancy, chronic disease, immunosuppression, or family history of serious illness lowers the threshold for medical review. Screening versus diagnostic. Routine tests, when asymptomatic, are preventative. The same test ordered for symptoms becomes diagnostic and may change next steps and cost. Preventative health maintenance means combining everyday self-care with scheduled medical screenings. To reduce disease risk and catch problems early. Self-care includes healthy habits, symptom monitoring, and basic first aid. Medical attention is required for alarming signs, persistent symptoms, or when your personal risk makes complications more likely. Everyday measures: balanced diet, regular exercise, sleep, vaccinations, hand hygiene, and routine screening per age and risk. Annual wellness visits and age appropriate screenings are core preventative actions. Minor acute problems: simple sprains, mild colds, uncomplicated diarrhea, small cuts that stop bleeding. Treat with rest, fluids, OTC meds, wound care, and watchful waiting for 48 to 72 hours. Red flags: chest pain, sudden shortness of breath, severe abdominal pain, high fever, uncontrolled bleeding, sudden weakness or confusion, signs of sepsis. These require immediate evaluation. Worsening or persistent symptoms: symptoms that don't improve or reoccur, self care, or any new neurologic cardiac or respiratory signs, abdominal screenings, results of family history, an unexpected screening, abnor- abnormally or a strong family history of cancer, heart disease, or genetic conditions should prompt diagnostic follow-up. Practical steps for patients. Know your baseline. Track chronic conditions, medications, and family history. Use time windows. Give minor issues 48 to 72 hours of self-care unless red flags appear. Document changes. Note onset, severity, triggers, and response to home treatment to share with clinicians. Risks and trade offs. Delaying care can let treatable conditions worsen. Overusing care can lead to unnecessary tests and costs. Insurance billing often distinguishes preventative screening from diagnostic tests, which affects out of pocket costs. Ask your provider or insurer if a test is screening or diagnostic. Closing recommendations. When unsure, ER on, ER on the side, error on the side of contracting or contacting a clinician. A brief phone or telehealth check can clarify whether home care is safe or an in-person visit is needed. Regular preventative visits and honest symptom reporting are the best ways to keep self-care effective and know when to seek medical help. Okay, here's the second part of A, guys. Preventative care keeps you healthy through routine checks, vaccines, and screenings. Diagnostic care investigates and treats symptoms or abdominal findings, and the same service can shift from preventative to diagnostic, which affects next steps and billing. Quick guide, key considerations, clarifying questions, decision points. Key considerations, symptom status, timing, personal risk factors, and whether A test is routine or prompted by symptoms. Clarifying questions. Are you symptom free? Is this a scheduled screen or a new problem? Do you have chronic disease, pregnancy, or immunosuppression? Immunosuppression. Asymptomatic routine care, preventative, new/worsening symptoms, or follow up of abdominal screenings, diagnostics. Why the distinction matters. Health outcomes, health outcomes, preventative services aim to catch disease early when treatment is simpler and outcomes are better. Cost and coverage. Under many plans, preventative services are covered with no cost, sharing only when billed as preventative. If a screening becomes diagnostic, for example, because of symptoms and abdominal finding, patient responsibility can change. Care pathway. Diagnostic care triggers targeted testing and treatment plans. Preventative care focuses on risk reduction and routine monitoring. Practical steps for patients. Use a 48 to 72 hour rule for minor stable issues. Mild cold, small sprain, while watching for red flags such as chest pain, severe shortness of breath, high fever, uncontrolled bleeding, sudden weakness or confusion. Seek immediate care for those. Ask before tests whether a visit or test will be billed as preventative or diagnostic to avoid surprise charges. Bring concise history, medication list, family history, and symptom log. Onset, severity, response to home care to help clinicians decide whether diagnostic evaluation is needed. Risks and trade-offs. Delaying diagnostic care for concerning symptoms can worsen outcomes. Overusing diagnostic testing for routine prevention can cause unnecessary procedures, anxiety, and costs. Insurance. If preventative and diagnostic services occur in the same visit, expect separate billing for diagnostic elements. Confirm coverage with your insurer. Takeaway. Preventative care is proactive maintenance. Diagnostic care is reactive problem solving. When unsure, Call your primary care clinician or use telehealth for quick triage. A short consult can clarify whether home care is safe or an in-person diagnostic visit is needed. Okay, guys, that's your A for this afternoon. I will be on with B shortly. Okay, give me a little bit to set that up, please. And I'll be back on with that for you. For now, Gator Wellness, take care, folks.